Kia ora, I'm Rhys and I'm a scientist in the genomics and bioinformatics team at ESR. I work alongside many teams here at ESR. Outside of ESR, I work closely with medical laboratory assistants and medical doctors, and our goal is to improve patient care and public health outcomes across Aotearoa. So we've set up a partnership with Awanui Labs in Wellington Regional Hospital, where we've implemented Nanopore sequencing in the clinic. Our goal is to identify pathogens that are causing an outbreak as quickly as possible so that our infection prevention and controls teams have more information available so that they can provide a more rapid response. So in the hospital, in real time, they can get a species ID and identify if this bacteria is part of the same sequence type, and then using that information, they can either open an outbreak investigation or withdraw. Alongside that is the work that we do here at ESR, which is a much more robust and in-depth analysis to see how these bugs are moving around, or even if they are moving around different patients within the hospital. We can also see if there's anything that gives these pathogens an advantage over other species, which could be why they've led to these infections. Back in 2007, there was an outbreak of Staphylococcus in the neonatal intensive care unit. And by 2014, they couldn't get it under control, which meant they had to close the NICU and relocate to a new refurbished facility. So you can imagine the costs involved with a move like that. Last year, we had an outbreak of Staphylococcus aureus in the neonatal intensive care unit. So we had 2 babies that were born and later they had crusty eyes. So we took some swabs of these crusty eyes and we were able to identify that they were Staph aureus. We were also able to determine that they were both the same sequence type, so sequence type 97. So using that investigation, we were able to open an outbreak. That led to screening over several weeks of all of the babies in the neonatal intensive care unit. And we actually found the same Staph aureus and the same sequence type 97 on 9 other babies asymptomatically. So again, we were able to call that outbreak from only 2 infections, and there weren't any other cases beyond that. By doing this, we were able to identify a possible transmission event from just those 2 initial cases and really nip it in the bud before it got out of control. It's amazing to see the work that I'm doing having a real impact in other people's lives, like real time. Like that's quite special.